My very first girlfriend left me because I didn't have time for her. Jesus Christ. We are building an AI solution for clinicians to be able to generate clinical reports. So the best way to work in the health sector and see what it is like there was to be.
So far, has there been a moment in your journey where you genuinely felt like giving up?
Absolutely. And I'm going to be sort of honest here, really. It's so hard, it's so difficult. The level of difficulty cannot be understood if you're not, in that situation. So it's not just working, right? You're pivoting over and over again. It's hard, no doubt. It takes everything from you. I've borrowed money from my friends. I've borrowed money from people. For me, I'm not supposed to borrow money from. Jesus Christ, I've lived on $20 for 1 week. I've lived on conflicts and sugar for one week, man. Jesus, it's unbelievably difficult. But in retrospect, the world is what it is today because a level of innovation was introduced at some point in history that's really changed what the world was during that time and afforded us the luxury to enjoy the level of comfort that we're enjoying at this time.
What motivates you to do that? Like, what is your, personal motivation? What motivates you to live your life?
Yeah, about that.
For those who never heard about your company, could you tell us in simple terms, what is it that your business offers and what problem are you solving with it?
Thank you so much. So Velara is a mobile company we are building. And we are building an AI solution for clinicians to be able to generate clinical reports. So I decided that the best way to sort of understand this problem in total, the best way to know exactly what we needed to build was to go and experience what it's like in the health sector. I'm not a doctor, I'm not a nurse, I've never worked in the health sector. So I figured, well, I can't go study medicine any longer. I can't really spend 4 years as a nurse studying nursing. So the best way to work in the health sector and see what it is like there was to be a healthcare assistant.
Has there been a moment in your journey where you genuinely felt like giving up?
Absolutely. And I'm going to be sort of honest here, really. I'm going to be honest. Sincerely, before we started building this stuff, I knew that building this was going to be so hard, but I didn't know it was going to be unbelievably hard. I mean, I could reconcile the fact that I've had a lot of stories, I've read a lot of stories and watched a lot of founder videos how they got started, the challenge that they faced. So obviously, I mean, in retrospect, I knew it was going to be hard. It's so hard, it's so difficult. The level of difficulty cannot be understood if you're not, in that situation. So I couldn't marry that situation when I wasn't building, when I was still in school, when I wasn't even a founder. I couldn't marry exactly the level of difficulty as it is now. It's not just working, right? You're pivoting over and over again. It's hard, no doubt.
What kind of challenges are you facing at the moment?
There's been a ton of challenges that we've experienced, from financial constraints to ensuring that what we're building is within the sort of regulatory guardrails that we know exist in the healthcare sector. And of course, which is why we aren't just building as sort of founders. We are also taking in medical advice from a couple of doctors who are super interested in what we are building in that sense. Financial constraints, especially to build this stuff. It's not like, you just set up a website or a landing page and then you've got a product out there. No. The amount of money we spent just training the model using healthcare data is a lot. It takes everything from you. I've borrowed money from my friends. I've borrowed money from people. For me, I'm not supposed to borrow money from, right? I've lived on I've really lived on. Jesus Christ, I've lived on $20 for 1 week. I've lived on conflicts and sugar for one week, man. Jesus, it's unbelievably difficult. So I've had an instance where I couldn't even pay my rent, right? Because there was no money, right? So I've had to, give excuses and tell my landlord to give me a bit more time and all of those. So these are setbacks, sort of these are challenges that we've encountered in the course of building over the various months.
Like, as you mentioned, we never expect how hard it is before we actually get there, right? So what have you learned so far from, hitting those rock bottom moments where you were like very close to giving up?
Every founder would hit them multiple times across every phase of growth, from pre-product to product and stability. One thing that keeps me going is this: we haven't launched what people want yet, right? We haven't launched what people are happy to use yet. So it's fundamentally going to be stupid for me to think about giving up now, because giving up based on what? The challenges notwithstanding are enormous, but until we get to that level where we have the products, people love it, people are using it. I'm not considering, it's a call to me to give up, but it's not an idea that I'm willing to execute upon.
Knowing what you know now, how hard it is, would you build the same business again?
Going into building stuff with some level of finance, right? Some sort of tucked away money. Probably get a job that pays me pretty well before I think about going into building a company. Unless I've got tons of money somewhere. Because if you're building from a level of lack or a place of lack, it's sometimes going to be difficult, to pull it off. But I'm gonna be honest, I love what I'm doing. I sincerely, genuinely love it.
A big challenge for any new business is obviously money, as you mentioned before. But the second one is how they're actually generating revenue to sustain themselves. How do you see that going forward?
My approach, right, on how we are going to sort of generate revenue and also sort of increase adoption by reducing risk is, most times, some of these legacy systems, right, enormous companies, right, have to pay thousands, hundreds of thousands of dollars annually to get them to use your solution in that sense. Some AHRs have to pay perhaps even up to $1 million annually.
Okay, so how are you approaching building different partnerships with those hospitals, with those clinicians, with those doctors? Because I'm assuming that's your really target market, right?
At this time, we are focusing on private hospitals, right? We've had discussions with some persons in the trust, but the pushback was enormous, so we decided to go with private hospitals until we have some significant level of sort of popularity. So we won't have that pushback when we come back to the trust. So regarding the private hospitals, it was based on reference. So I spoke to a couple of clinicians. They were like, "Hey, you should go talk to so-and-so person at this hospital. They have tons of problem in this area that you guys are doing." So we took the initiative. I spoke to 3 persons in the hospital. They were like, okay, you guys will come up with a demo, right? You got to come up with a demo. Let's see how it works. If it works, we would adopt it. Now, this is largely the problem we are facing with how we sort of are approaching the whole partnerships or securing these clients. Is basically, okay, this is a problem that we've experienced, and this is the solution that we are building. Is this something that you think is going to make your work efficient? Do you think it's going to make it easy for you guys to adopt our solution? Will it solve these problems that you guys are currently facing? So basically, we try to articulate the problems and then tell them what we are building and ask if they're willing to see what it looks like. They're willing to adopt it. And some of the times we hear positive. Some of the times we hear some sort of we are ready, blah blah blah. What we have now is good enough for us.
Going to your current focus, what is it at the moment?
So our focus is just to get this stuff out in the market, right? Ultimately next month, have this stuff ready. Have this couple of hospitals sort of using it and then getting their feedback and iterating based on their feedback.
What's the future? How do you see your company evolving in the long run?
Yeah, 1 year from now, 2 years from now, we want to be operational in the US as well. And there is also a slight chance, right, in my mind, that we're going to move into hardware, right? um, building some sort of AI conversational pendants, which clinicians can have on themselves while they're having these conversations with patients, right? That automatically is integrated to the EHR used in each of their hospitals. So there won't be any need to use pens and papers, right? So largely we would be getting out from the back office into basically the interface where patients and clinicians are conversing.
What motivates you to do that? Like, what is your, personal motivation? What motivates you to live your life?
Yeah, about that. I really don't want to just pass through life without making an impact. And I mean, making significant level of impact that I'm remembered for my area of expertise specifically, right? So let's say in the healthcare industry, I want to be one of those who um, is going to be mentioned perhaps decades or centuries after I'm gone, that this industry is what it is now because of this man, right? I don't want to just live life and then that it is. No, I really want to make that's great significant impact where my involvement in an industry, my involvement in a particular focus area really helped to shape that industry from what it was to what it is, to what it would be even after I exit.
If you were to be a president of the world and you could change one thing, what would you change?
It's a oh damn it, man. Tell you what, there's probably nothing I would change existing in the world today. Because what I would have loved to say that I would change is to give people the ability to make decisions they want and act on it without consequences. But it turns out that there is already that free will that comes with making decisions the way you want, but then there is consequences. Now, the reason behind without any consequence is on the facts where people who want to be rebellious because they want to make a change, a positive one, would have consequences. Not when you're bringing in a change that is negative. There should be consequences for that.
How would you decide what is a good change and what is a bad change? In terms of like, there has to be consequences, or there will be not consequences if you change this, there will be consequences if you change this. How do you decide, and who is deciding?
And as a Christian, we have a standard, and our standard is Christ. And also going by the fact that our standard is Christ, we also have what we call conscience, which is it's more like a policeman in our hearts. So you know that when you're doing something right, you know that this is right. When you're doing something wrong, even though you might not accept that it is wrong because you want the comfort that comes with doing that, someplace in your heart you would know that this is wrong and it's not ideal.
Let's say that you can change the healthcare industry around the world, but that in some way will kill, let's say, thousands of people because of something. It's just an assumption now, but it will help on the other side, speed it up everything, and because of the efficiency that you introduce, it will, save millions of lives. Is that good or is that bad? Is that correct or is that wrong? Is that a good change or is it a bad change?
That's interesting. That's a very brilliant point of view. A lot of people are saying that fundamentally some of the duties, some of this back office are done by admin persons, right? And if we should implement what we are building, a lot of people are going to lose their job. But in a retrospect, the world is what it is today because a level of innovation was introduced at some point in history that really changed what the world was during that time and afforded us the luxury to enjoy the level of comfort that we are enjoying at this time. So during those introductions, a lot of people lose their jobs. A lot of people who didn't decide to go with the trend, right, upscale themselves, lost their jobs, or lost their jobs to some other people who really were sort of progressives. So yes, there might be arguments that people are going to lose their job. Because fundamentally, I am building this based on my idea that the inefficiencies existing has caused a lot of harm than it has really done any good. Patients, why do patients have to wait 24 hours, right? Someone could actually die, right? Why do patients have to wait for, to be seen by a doctor, even after they are seen, nothing happens till another significant amount of time has passed. Why all of that time, really? When you go to private hospitals, sometimes it's not actually like this. There are some hospitals, some private hospitals that function optimally, right? These delays are not experienced there. So why can't the healthcare industry actually function like these hospitals? The system has been so broken that people think it cannot be fixed. And perhaps it cannot be fixed if the right things are not done and implemented.
Thank you very much for joining me. It was a pleasure to talk to you. And as you know, I would love to follow up with you in the next 6 to 12 months to see how your journey progressed from today. And yeah, I'll see you then.